Hello, my dear doctors. I'd like to discuss a topic now that is Idiopathic Pulmonary Fibrosis, IPF. We call it the name that is the CFA, that is Cryptogenic Fibrosing Alveolitis, CFA, right? So, Idiopathic Pulmonary Fibrosis, that is IPF, previously termed that is a Cryptogenic Fibrosing Alveolitis, that is CFA, is a chronic lung condition characterized by the progressive fibrosis of the interstitium of the lungs. So yes, the progressive fibrosis, circle progressive the word. Whilst there are many causes of the lung fibrosis, medications, connective disease and asbestos, the term IPF is reserved when no underlying cause exists. IPF is typically seen in patients aged 50 to 70 years. So circle 50 to 70 and is twice as common in men. Features progressive exertional dyspnea, so circle progressive, and bivasal crackles on the auscultation and dry cough and clubbing. Diagnosis: the spirometry, classically the restricted pattern, FEV1 normal or decreased, FBC decreased, and FEV1 FBC is increased. Impaired gas exchange, that is a reduced transfer factor, that is TLCO or KCO. Imaging: bilateral interstitial shadowing, typically small irregular peripheral opacities, that is ground glass, later progressing to honeycombing, so circle ground glass and honeycombing, may be seen on the chest x-ray, but HRCT means high resolution CT scanning is the investigation of choice and required to make a diagnosis of IPF. NR positive in 30% cases and remitted factor positive in 10% cases, but this does not necessarily mean that the fibrosis is secondary to a connective tissue disease. Titers are usually low. Management is a pulmonary rehabilitation. Very few medications have been shown to give any benefits in IPF. There is some evidence that pirfenidone, circle the pirfenidone, an antifibrotic agent, may be useful in selected patients. Many patients will require the supplementary oxygen and eventually a lung transplant. So circle oxygen and circle the lung transplant. Prognosis is poor. Average lifespan is around the 3 to 4 years. So circle 3 to 4 years. So IPF is a very hot topic for the exam, my dear. Let's discuss. All right. So here's the SS box. Or before going to the idiopathic pulmonary fibrosis, I would like to discuss the disease of clubbing. But the full discussions that I'll do in the chapter of clinical science. But the clubbing is the most common. Of course, clubbing is caused by the hypoxia, is the inducing factors for proliferations of the soft tissue in the nail bed, causing a bulbous appearance of the tips of the fingers, so causing this clubbing. So because of hypoxia means the oxygen, so oxygen we are taking by the respiratory system, so the lungs is the most important organ causing the clubbing. So whenever you have the clubbing, please think about the respiratory system involvement. Means the respiratory diseases are the involvement for causing this clubbing. So let's do it. The clubbing, the respiratory causes. If you write the clubbing, the respiratory causes. I'll discuss the other causes of clubbing and the detail of clubbing in the chapter of clinical science. But here we need a little bit. Whenever we have the clubbing, the rule of C, the first diagnosis, cryptogenic fibrosing alveolitis, my dear. If you enter into the respiratory clinic, if you see a clubbing from distant, you can diagnose. This is a case of CFA fast. Think about it. Fast means cryptogenic fibrosing alveolitis or IPF. All right. Next, C is chance. That is the cystic fibrosis. Means the bronchiectasis, all right. Third C stands on the cancer, of course, the cancer. So these are the rule of C is of clubbing caused by the respiratory system. So yes, I would like to discuss a little bit. Bronchiectasis is nothing but the suppurative lung disease, we can say. Suppurative lung disease, SLD, we can say. So the suppurative lung disease, once again, stands on, we can write the abscess, lung abscess, if you write the abscess. B for, once again, the bronchiectasis itself, all right. And C for cystic fibrosis, yes. And D is absent, all right. Next, the E for empyema that we need to remember. Means empyema thoracis. These are the suppurative lung disease. A group of disorders can produce the clubbing. So these are the list A, B, C, D, and empyema. Yes, the cystic fibrosis is the most common cause of bronchiectasis. We'll discuss in another video clips that the bronchiectasis. And once again, the cancer. Cancer is, of course, the bronchogenic carcinoma, we call, but the most important cancer causing clubbing, that is the squamous cell carcinoma. So the next to the bronchogenic carcinoma means the squamous cell carcinoma, another cancer that is mesothelioma that we need to remember, this is causing clubbing. So this is the box, my dear, of causing clubbing. Next to the box is another box that I'm giving. If the patient comes up, I'm saying the 3 C's means the cough. You found the clubbing and crackles, right? You found the crackles. So these 3C is a bundle pack of another 3C disease that we need to know. Means if a combination of this cough, clubbing, and crackles, we can think about the first diagnosis, once again, the CFA. Second diagnosis, once again, the cystic fibrosis means a cause of bronchiectasis, and all cause of bronchiectasis sometimes, all right? And last C stands on the, once again, the cancer. So making this box, once again, this clinical box will be really helpful, my dear. So once again, the cough, clubbing, and crackles, all right, the CFA and cystic fibrosis, and also the cancer. Next, we now talk about the SS box, that is CFA, or now we call the idiopathic pulmonary fibrosis. So, cryptogenic fibrosing alveolitis or idiopathic pulmonary fibrosis. The clinical features, if I say it, of course the 3 C's will be there. Means C for cough, C for clubbing, C for crackles, all right, we know about it. This bundle pack we know, but the most top of the list, that idiopathic pulmonary fibrosis, a P4. This is very important, that is progressive shortness of breath. Progressive shortness of breath. SOB. That is the presentation, all right? Means the clinical features of idiopathic pulmonary fibrosis. A little bit discussion with the crackles. This will be helpful. Means because of this cryptogenic fibrosing and also the cystic bronchiectasis, the findings are very similar. So we need to discuss a little bit differentiating points in between the CFA And if I write the CF means the bronchiectasis, a little bit differentiation will be helpful. Cryptogenic fibrosing alveolitis, of course, both will have the 3 C's if you made it right. So you can think about the CFA and CF. So how to differentiate clinically, that is important. So clinically we are CFA, if you can think about this, a restrictive disease, and this is the obstructive disease. So we can think about a little bit more, right? So in a restrictive disease, an inspiratory problem. So we are getting the crackles here as well as here, both-sided crackles. But the difference is the crackles in the CFA is the bibasal end inspiratory In contrast, this is throughout the inspiration, throughout the total inspiration, means doesn't need that the end inspiratory. Fine. In contrast, this is coarse crackles, and that essentially changes after coughing. No changes. So this is the differentiating points in between these two. Because of this obstructive airway disease, we are getting a vesicular with prolonged expiration, a breath sound, all right. So this is a very important differentiating points in between these two. And if you do the pulmonary function test, definitely we'll get the RLD, and here we'll get the O. All right. Now talk about how this pulmonary fibrosis IPF means the diagnostic test. This is very important. SS box. IPF or cryptogenic fibrosing alveolitis diagnostic test equal to HRCT scan. Means the CT scan is the diagnostic test. And we do the pulmonary function test that will reveal the RLD plus reduced TLCO or reduced KCO, whatever. So the diagnostic test is an HRCT, and also we do the test, the pulmonary function test. In HFRCMCH, we are saying that they have sometimes just write it down the ground glass, the word, the ground glass appearance, and sometimes they turn into the honeycombing appearance. So ground glass and honeycombing appearance, just write it down. And last box that I would like to give, right? There is the idiopathic pulmonary fibrosis treatment in CFA treatment, all right? So I'm saying that idiopathic pulmonary fibrosis treatment, the pirfenidone that must be remembered. So IPF is nothing but the pulmonary fibrosis, and pulmonary fibrosis means the pirfenidone. We can remember now, so that will be helpful, my dear. And the prognosis, regarding prognosis, is poor. if I write the last box, that is IPF or CFA, P for poor prognosis. And this poor only survival rate is said that 3, 4. This is the last box. Alright. Listen, my dear, I'd like to discuss a little bit more so that it will be helpful. Yes, let me start by first box. That is, clubbing is a rule of C's. C for CFA, CF, and cancer. C for CFA, CF. And then CF is not a bronchiectasis, is a suppurative lung disease, means A, B, C, D, E, alright? So abscess, bronchiectasis, cystic fibrosis, D is absent, alright, empyema, thoracic, alright? C for cancer, of course, the bronchogenic squamous cell variety and mesothelioma that we must remember, causing clubbing. Second box is a bundle pack of 3 C's, means the cough, clubbing, and crackles is a bundle pack, is a disease of another 3 diseases, my dear, that is CFA, CF, and cancer, that we need to know. Third box, once again, the cryptogenic fibrosing alveolitis or IPF clinical features. Of course, the C, we know about it, 3 C's, but we need an emphasis on the pulmonary fibrosis, means progressive. This word, the pulmonary fibrosis, progressive shortness of breath. We need to remember this. Next is the 3C. 3C is a DD, we already talked, right? CFA and also the bronchiectasis. So these are very close, all right? Because both have the CF. See? So of course this is a restrictive disease. This is obstructive disease. That's why we are getting a restrictive lung defect and obstructive lung defect. And we are getting, yes, the crackles. In both cases, the crackles. And differentiating points in crackles. That will be very helpful in clinical at the bedside, that you see bibasal and inspiratory rather than in throughout the inspiration. These are fine and these are coarse and no changes after coughing in the CFA, but in contrast it changes after coughing. So all C, all right, in cystic fibrosis. C, all right, yes. Fifth number, the box, right, the diagnostic test of idiopathic pulmonary fibrosis and cystic fibrosis, cryptogenic fibrosing alveolitis, that is CFA or IPF. Diagnostic is the CT scan and pulmonary function test. We need to remember. So once again, the CT scan, CFA, and pulmonary function test, CT scan and pulmonary function test, we need to know. And of course the findings are, we know about it, the restricted lung defect and TLC and KCO. A bit word that this is helpful, my dear, the ground glass appearance rather than honeycombing appearance. So ground glass appearance is very important. We need to know if we get the ground glass, having a prognostic value, because these ground glass appearance are Z for ground glass, Z for glucocorticosteroid responsive, means that if the having in the HRCT is a ground glass appearance, so that we can remember this Z for ground glass, Z for glucocorticosteroid, means steroid responsive diseases. And later made they change into the honeycombing. Sixth box, once again, the treatment, of course, the IPF, I am saying the PF for pirfenidone. We need to remember this drug. This is a specific anti-fibrotic drug. Must remember, this is US FDA drugs and used in the pirfenidone in the treatment of IPF. Number 7 drugs, you see the prognosis, the IPF having the 3, Just remember, you see the IPF, the number 333, so the 3. Yes, CFA is a 3-letter word. So yes, the 3 years is a prognosis, a poor prognosis. The survival is the 3 years. So I'm summarizing once again, my dear. Clubbing is a rule of C's. And 3 C's is the diagnosis, the 3 C's second box. Pulmonary fibrosis, clinical features, the progressive, the word that we need to remember. Fourth, number 3C, the CFA and C, but the most important, the course changes after with the coughing in the cystic fibrosis, the bronchiectasis. And next, you see the diagnostic test is the CT scan and also the pulmonary function test. And next is the PF treatment, is the pirfenidone, is the treatment. PF treatment is the PF. And last box, IPF is the 3, CF is a 3, so 3 or 4 years is the survivability. I hope that you enjoyed my the boxes. This is very helpful. Thank you very much. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.